I'm Dr. Priyanka, and today I'm here to discuss about a topic that is endometriosis. So, what do we understand by endometriosis? So, endometriosis, the term means the endometrium is in a different location than where it should have been. So, what exactly is endometrium? Endometrium is the inner lining of the womb or the uterus. So, every month when a lady gets her period, this endometrial lining is generally shed and it comes out. For women who have endometriosis or due to other reasons also, the endometrium, that is the lining of the uterus, in addition to coming out, also goes up through the tubes and it goes and gets deposited in other areas like in the ovary or over the fallopian tube, over the urinary bladder, on the uterus and all the surrounding tissue. So every month as she gets a period, there is reaction and there is bleeding happening in all these spots, because of which this goes on like a long-term process, and then there develops the problem of adhesions, that is one tissue getting stuck to the other. In ovaries there is a condition called endometrium where there will be blood clots inside the cyst, or there will be cysts containing lot of blood inside it. So these problems tend to happen in endometriosis, and in general population, though the incidence is less, but it is very frequently seen in women who are having difficulty in conception. And how would you know if you are having endometriosis or not? This is a question many women ask. So a very common symptom of endometriosis is having severe or very painful periods. That is, some women complain that even 2 to 3 days prior to their getting period, they start getting a lot of pain and discomfort, which becomes more immediately after the bleeding starts and continues for some time. So this having pain even like 2-3 days or even 5-6 days prior to your periods, having severe pain during periods, so much so that some women even require injections or tablets, that could be indicative of endometriosis. Then some women complain of having pain during intercourse, so much so they are not able to have intercourse at all. Or some women may even be having pain during passing urine or while passing motion, and some may experience a general pain throughout their cycles, like more pain during periods, and even after periods the pain continues. So these could be other indicators of endometriosis. So how do we tackle it? There are two ways of tackling endometriosis. One is giving some medical treatment or going and doing a surgery. So medical treatment would be mainly for women who are not planning a pregnancy, and those whose symptoms are predominantly pain related. But women who are planning for pregnancy, the treatment is more in favor of surgery, that is more towards laparoscopy, wherein we put a camera inside in the abdomen and check where all the deposits are there. If there is any cyst formation, that is the blood clot or the blood collection inside the cyst or on the ovaries, we check for that. We drain those cysts, we clear the cysts and burn all the deposits which are there. Check for the tubes in the laparoscopy, and once we see the tubes are fine, everything else looks good and the male parameters are normal, then we can suggest to go for either natural pregnancy or IUI. And if there is a lot of damage, the tubes are damaged, the male factor is not that good, the male or the sperm parameters are not good, then we could suggest IVF in such couples. I hope this has helped you in understanding about endometriosis. Thank you.